This is a Hope 1032 podcast.
I don't know if you found this too, Pansy, but heaps of the female doctors that I'm friends with have been using their children's stimulants and have been quite interested in being diagnosed themselves, which may surprise people.
To She Wasn't Born Yesterday for women who are 40 plus fabulous by the Empty Nest Chicks. I'm Janet Evans, ex-M&T Saatchi advertising creative who have won numerous radio and TV awards. Not that that'll affect us because we're doing a podcast.
And I'm Dr. Amelia Haynes, who has been a medical doctor for 30 years and specialising in sexual health and mental health and relationships, and I'm generally a very useful human being.
Well, we'll find out about that, but we are here to work together.
People tell me on good authority that I am.
Really? Yes, well, they never say that to me, so I think we're the perfect hosts for She Wasn't Born Yesterday.
Hey, Janet, when your son was going through school, do you remember if other parents had children or there were other little boys zipping around who got the diagnosis of ADHD?
Actually, I do remember there was some, and I do remember the whole Ritalin thing, kids started being given Ritalin specifically.
Yeah.
Actually, I don't remember a lot of kids being diagnosed.
Do you remember meeting any kids where you thought, oh my goodness, there's something going on with that kid?
Yes, actually, yes. Yes,
you do? Okay.
Yes, something going on. But, it's a little bit vague, isn't it? For someone, are they just hyper-energised? Are they just, enjoying a really high energy activity and they're going to come down later? Or, how do you sort of, it's not like you go, oh, you have definitely got ADHD. I can tell from my vast experience.
Well, Exactly. Well, one of the interesting things about right now is that adult ADHD is being diagnosed like a tsunami of diagnoses. Yeah. It's very hot to get the diagnosis at the moment. And women in particular, because we're unusual, so little girls are being diagnosed as having ADHD and it's different for little boys. And then when they become 40 plus fabulous, like our listeners, quite a few of them are also being diagnosed. So today we're going to speak to someone who actually looks after those people, diagnoses them and treats them. And yes, we can find out more from Dr. Pansy Lai.
Dr. Pansy Lai.
Yes, and let me tell you about Dr. Pansy. She works as a mental health GP at the Mindsight Clinic at Gordon in Sydney. She has completed a Master's of Psychotherapy and combines medication strategies with trauma-informed psychotherapy. She sees patients in mental health assessments and treatment for a wide range of mental health conditions. So she does treat adult ADHD, but she also, she's not confined to only doing that. Now, right in front of us, we have Dr. Pansy Lai right now.
Welcome, Dr. Pansy.
Yeah.
Hello, guys.
So, as you can tell, Janet and I are quite ignorant about the whole new thing of females in particular being diagnosed either as little girls or as adult females. Actually, my first question is, why do you think it has turned out to be so kind of such a growing thing over the past few years? Why has that happened?
I think our understanding of ADHD has changed a lot. I think back when maybe we were growing up, I think I'm 40 and fabulous as well.
Though she does look rather younger than us. But anyway,
so annoying.
Anyway, we'll just go with you there. Yeah.
So when we were growing up, I think we saw ADHD as more of a behavioural disorder. So we would pick out the kids who were a little bit troublesome, loud and hyperactive. And then we weren't really good at picking up what we call the inattentive subtype of ADHD. And so that's kind of more your quiet quiet little one, just sitting at the back daydreaming, but not really engaging with what's happening in the classroom. But because they weren't troublesome, they were just, quietly sitting there. We didn't really kind of pick them up.
They weren't squeaky cogs. They weren't making any noise. So
that's right. Yeah. And so we've kind of really moved from ADHD being like just a behavioral disorder to understanding what really goes on inside. And, I hear you kind of picking up, why is it that it's more the little girls or the adult women, coming to get diagnosed now? I think there are a few factors. I think the prevalence of girls and boys getting inattentive subtype is actually very similar. But the boys do get what we call that kind of hyperactive, impulsive or combined subtype where you get all three a lot more. And so growing up, the boys were probably diagnosed and all the inattentive ones were probably getting missed.
Yeah.
So the other thing, which, may be a bit controversial, but I think our audience would agree, is that women, are probably trying harder to mask their symptoms. Like as they're growing up, little girls are probably socialized to kind of be more, trying harder, functioning better. So they probably end up working really, really hard to mask their symptoms. So they're still getting the grades. They're still perceived to be trying or doing okay. And so they're not picked up just because they just like kind of falling under the radar. But, the personal cost of that is that they probably have been working so hard to mask these symptoms, working so hard to get organized, get their work done. So they're not achieving the potential. And also, by the time they get to teenage years and when they get to that kind of late high school, they're probably working so hard that they're starting to burn out. They're starting to get diagnosed with maybe the anxiety or the depression or even getting some kind of yo-yo sort of symptoms like eating disorders, trying to be completely in control or completely impulsive. That manifests in other ways, even like substance use, for example, right? Sure. One last factor that I can think of is that by the time we get to you're like, working a high-functioning job, having kids and, managing a whole host of different things, maybe all the masking and all the working hard has just come to a certain limit and things are just starting to crack. And people are just kind of going, hang on, something's not quite right. Like I've been working so hard and I'm just, barely kind of surviving. And I think women are maybe a little bit easier to kind of admit, hey, it might be good to get some help. Whereas a lot of men, maybe they're actually getting help only when their partners just go, hey, you need something.
Actually, what sort of things do you find make it difficult for women to actually present for diagnosis and treatment at the moment? What sort of things are kind of holding people of our age kind of back?
Well, there's a lot. Firstly, you got to actually have the time and space to actually think about this, right? And when you're like really drowning or just trying to survive or, paddling very hard, you don't have time for yourself. You have time for everyone else. You don't have time for yourself. Yeah.
That's a good point. What actually is ADHD? What does it stand for? Because I feel like back in the day it was just ADD, attention deficit disorder.
Yeah, so attention deficit hyperactive disorder. Yeah.
Right. The age got added in for hyperactive.
Right. But will someone have all of those things? So attention deficit as well as hyperactive at the same, all in the same package?
Yeah, so kind of backtracking a bit, as we said, like there's kind of that predominantly, when you're kids, maybe you're kind of more differentiated into that kind of inattentive subtype where you're more having the difficulty focusing, distractibility, forgetfulness, difficulty kind of starting things, procrastination, completing things. The kind of hyperactive impulsivity would be kind of more pronounced as like, that kind of, can't sit still, being really impulsive, kind of troublemaking sort of thing. But by the time you get to an adult sort of stage, most of it is like, even if you only have the predominantly hyperactive impulsive subtype, you usually have inattentive symptoms to go with that. So by the time you get to adult, you usually have either a combined subtype or an inattentive subtype. Yeah. But the way the symptoms manifest in adults are a bit different. So when you are a kid, the impulsiveness might be, sock someone in the head, right? But when you're an adult, it might actually be different. So like you might end up, spending too much or like, maybe just kind of having really a lot of passion on an interest, on a hobby, buying everything you need to learn crocheting, or like, a craft or an instrument. And then halfway through just, lose interest and then just have piles and piles of project, just around the house and never actually, finishing that like crocheting. So maybe changing careers all the time. So, being really interested in something, in a job. And then when it gets to the boring part, you can't quite finish it, that sort of thing. Not writing reports, not writing your notes.
That's interesting.
Yeah, I was going to say, this seems so appropriate that we are doing this podcast for women who are over 40. What sort of things should women of that age, when they're thinking back over their lives, what sort of things might be giving them a clue that they actually should bother to turn up for assessment? And what sort of things turn up in middle age too? Like, just describe your typical kind of woman who might have it.
Yeah, you know what's the typical presentation is when their kids get diagnosed, because ADHD is actually very hereditary. It's about 70% hereditary. So when the kids get diagnosed, the doctor kind of looks at the parents and says, so which of you, probably passes down and they're like, oh, that makes a lot of sense. And then a lot of them then start the journey because they actually want to learn about it so that they can help their kids, right? But by the time they come to me, they probably already have a lot of things in place. Like their calendar has so many things on it. Their to-do lists are just, kind of completely, chock-a-block, and they're just, hitting all their goals by this time. But if you really go back to the educational kind of developmental history, that's when you find out a little bit more, like, were they really interested in study, or maybe they just kind of, flying through, not working very hard, but because they're bright, they're just getting through it. Or maybe they were actually like never really organized and they needed a lot of help and support to, get things together and hand things in. And then by the time they get to uni, for example, everything just fell apart because there weren't that sort of structure and support anymore. There can be a lot of different ways it shows up.
Wow, but it would be tricky for you, like if people bring their kids in and, and you kind of look at them or ask them a few questions, for you to be able to kind of get an assessment of them, wouldn't it? If they weren't keen to get one for themselves, is that right? Or how do you deal with that?
Yeah, so when I do an assessment, I would spend, at least 45 minutes to an hour with them, really hear their story and, really go into kind of, the challenges that happens, through their life, in their past and in the present, and just talk about like all the different parts of their life, like their work functioning, their relationships, how it actually affects them.
Yeah, wow.
How does the assessment run? Because I'm sure a lot of people sort of think, fascinating, maybe I do have it. Yeah. But they have no idea what the assessment actually looks like. Like, how are people officially assessed and diagnosed?
Yeah. So there used to be two main ways. Now there's three. So firstly, people would go and see a psychiatrist. That is more of kind of a clinical assessment where, the psychiatrist will sit down and just chat to people for a long time. And then there's another way, which is seeing a psychologist, and they usually do some standardized testing where they will, be able to give you a probability of, how likely this diagnosis is. So the third way is to see a mental health GP like myself, where we would actually do that kind of clinical assessment as well.
Is the assessment, is there a questionnaire kind of element that you do on your own, or with someone aiding you, or interview as well?
We do give people a whole bunch of paperwork and they hate it. They're like coming and going, you gave me so much homework before I even turn up.
So that proves you've got ADHD, right?
But basically, people aren't being shoved through MRI scanners or PET scanners to being diagnosed. No.
Not really,
They're doing it through questionnaires followed by clinical kind of assessment.
Very much.
Yeah.
So what actually causes ADHD?
That's a really complicated, kind of question. I don't think there's a very clear answer. Okay. If you look at the kind of like the brain pathways that are affected, there are like so many. There are kind of many, many different theories. So I don't think we can lock it down quite yet.
Oh, yeah. That's interesting.
It is basically to be pinned down.
Oh, that's fascinating. So you can kind of assess it and diagnose it and treat it. But
we know it's got to do a lot with the dopamine pathway. So that's, kind of the reward center of the brain and, the way we kind of... So if you kind of think about it, you can think of ADHD like, the dopamine are not kind of coming through quite right. So the engine's kind of not starting. Yeah, I think you can kind of think of it that way.
How would that manifest itself? So if I do something and it's, I achieve something, say, I tick off everything on my to-do list, I would get a dopamine rush. Is that right?
So I think, it's not really clear to us how ADHD is caused. I think it's very multifactorial. But what we do understand is that it affects a lot of the brain pathways. It's all over the place. It's not just one part of the brain. And what it affects is the executive function. Executive function is actually a myriad of things, right? It's our ability to sustain concentration, be organized, be able to have motivation. How we actually regulate emotion is a big thing. So a lot of people miss this symptom in ADHD, which is the emotional dysregulation, the ability to kind of hold in our impulsiveness and also to kind of manage delayed satisfaction, to kind of sustain our efforts without, immediate reward. And so that's really related to the dopamine pathway. So yeah, I can go on, but there's lots involved really.
Yeah, right.
Yeah.
So what do you mean by that delayed reward?
Gratification.
Yeah. What do you mean by that? So how would that present itself?
So it's like, if you kind of like say to a little child, here's a lolly, but if you hold on and don't eat it now, I'll come back in 10 minutes and give you another lolly. So what are they going to do with that lolly? Would they eat it straight away, or would they be able to kind of distract themselves and do other things, hold off so that they can have that delayed satisfaction?
And adults are very, very similar. They're very similar.
Especially these days.
Yeah, exactly. People say you have to do these for 10 weeks and then you'll be able to blah-de-blah. People find that very hard. Yeah.
That's right.
Well, it's instant gratification age, isn't it? I mean, if your internet is like even just a little bit slow, you kind of go, come on, what's going on?
Yeah.
I haven't got time for this.
Guilty.
Yeah. Now, you talked about Ritalin before. What sort of treatments, if you are diagnosed, what sort of treatments are available for people who are diagnosed?
So psychostimulants is first line. So that includes Ritalin and the dexamphetamine or the long-acting versions like Concerta or Vyvanse. With adults, we do like, kind of using more long-acting formulations. And there are also a lot of strategies that we can do. So if I can use the same metaphor, if we give the meds to kind of, start the engine, right? But if you kind of are trying to get to Queensland and you keep driving down to Tasmania, then you're not going to actually get to where you want to. So once you are on the medication, if you're kind of still choosing to kind of use your brain the same way and just go down the same pathways, sideways, then it still doesn't quite work. So how we actually manage it is we see the psychiatrist, prescribe for the medication, and then I actually see people for quite a few sessions to first support them in titrating the dose, and secondly, to kind of give them some skills, some coaching and some therapy to kind of help with building up some kind of new brain pathways, because our brain is neuroplastic. And so when we are swimming in the right kind of chemical environment and we actually have this, much calmer and more space in the brain, we can actually choose new ways and new patterns of behavior that will actually help us improve all those sort of functioning.
But is it harder for someone who's a little bit older to be able to mould their behaviour or change it compared to, say, a kid?
With kids and teenagers, it is easier in that the brain is, developing much faster and there are kind of more scope to change behavioral patterns. But having said that, a lot of the adults who are presenting already have a lot of strategies in place. And the thing is, a lot of people, when they think about people presenting for ADHD, they're not usually just doing it because, they just want drugs or they just like that, the kind of trivial idea of people are just trying to see if, they have it or they can just get drugs. It really isn't like that at all. When people were presenting, they are really motivated to improve their well-being overall, right? They want to improve their work functioning, their relationships and overall well-being. So they're really very motivated. So I really enjoy working with this clientele because people just work hard and they want to, learn skills. So it's actually great.
What do they tend to report to you? What sort of things do people tend to actually feed back to you once the stimulants have been given? What do they tend to say back to you as to how they feel and anything beneficial that starts to happen? What sort of things are they saying?
Well, the best case scenario is that instead of having 65 channels all going off at the same time and they can't really, work out what's going on, it's a lot calmer. They have a lot more space. And the idea is they now have choice. So they can see that this is where they used to go, just go sideways, down a trajectory. Now they're like, okay, there's that, but there's this, and I choose that because this is what I want to prioritize right now.
Okay.
So how long does it kind of take to get to that point typically? Or is there no typical journey?
I think everyone's different. So I really like to say people for at least 3 sessions just to start with, to kind of, give them some things to start working on. Some people like to just take those and work on it themselves. And then once they're on the medication, they stabilize on the right dose and they've got some strategies, then they really do very well, very quickly, actually. Some people, they may actually have other kind of really set patterns of behavior that has built up over the years. They may have different complex issues. And some people go on to kind of work on themselves a lot more because they find that, it's not a simple solution. The things that they're looking for actually require deeper work, but it ends up being very rewarding as well.
Yeah.
I'm intrigued by that idea of the kind of calming down of things. Is it because they're kind of surrounding themselves by so many different things and everything is just chaotic because they can't actually achieve those things in any kind of systematic order? Is it
easily distracted, that kind of thing?
Right.
Yeah.
Right.
Yeah, so a lot of times the executive function is not there, and so the organisation or prioritisation or the focus is just not around. Yeah.
Because, one thing you do is you prioritise things. You have lots of stuff to do, but, okay, today I have to do this, this, and this, and I'll do it in this order. I usually like to get a big thing out of the way first and then follow up with a lot of little things because I feel like I'm achieving a lot of stuff.
Yeah, see, that's a really good example of how to prioritize, actually.
Yeah.
But, if you hear of an ADHDer's kind of experience, they would go, I know I'm supposed to do this and this is due tomorrow, but I look at something and then I just went over and did it for 5 hours and just they didn't actually have the capacity to switch focus or just pause and plan the day.
Wow.
As well as people like yourself, and I presume psychologists as well, who will continue to touch base with people who are being treated. What other sort of support is out there now for people who have been diagnosed with ADHD?
Yeah, so I really highly suggest people who get treatment, medical treatment for ADHD to also maybe find someone that they can work with. So either an ADHD coach or therapists who have, or psychologists who have ADHD training and expertise.
Okay, yeah. I want to ask Pansy if you think that my co-host Janet has ADHD.
Just by looking at me.
Look, to be honest, it's very hard to diagnose someone just over even a dinner conversation. I would say, how people go and study a course or, gain experience in a certain degree so that they can learn more about what's out there, right? If we want to think about, investigating your mental health as learning what's in here, right? Because this tool yourself is what you use to approach everything. Right.
Yeah.
And so I think there's never any harm to kind of explore and give yourself some space to kind of look into yourself. So if you're seeing, a counselor or therapist or psychologist or mental health GP, that's never a waste of time. Right. So you need to kind of have that permission to kind of look into it. So if someone, actually comes to me through a dinner conversation going, do I have ADHD? I'm like, what are you looking for? What is it that is not quite right? What is it that you're hoping to achieve that you're not there yet? And is there space for you to look into it right now? And how would you go about it?
Such a mature answer. Wow.
I know. Much as I asked about you, basic truth is I want to have the assessment and be checked out.
Really?
Yes.
You heard it first here on She Wasn't Born Yesterday.
I was going to say, I'm quite fascinated and motivated. And actually heaps of, I don't know if you found this too, Pansy, but heaps of the female doctors that I'm friends with have been using their children's stimulants and have been quite interested in being diagnosed themselves, which may surprise people because I'm sure people think doctors are very organised and very good at obviously doing exams and doing well and so on and so forth. But actually lots of doctors who are friends of mine have actually put their hands up and done the testing and being diagnosed and are now being treated and feeling like life is finally making sense. And I was going to say, I don't know, Pansy, what your experience has been because everyone must know what you do now. So do you have friends like that too?
My comment on that is, yes, there are definitely doctors who have ADHD. There's a myth out there that says, if someone's really high achieving, then they can't possibly have ADHD. It's not really that. It's what is the opportunity cost? Like, what are they missing out on, and how much harder are they working in order to kind of achieve the same level of success, right? So yes, definitely, bright people can have ADHD too. Mm-hmm. But now the other side of the coin is this, right? Doctors or other really highly functional, high achieving human beings have a lot of expectations on them. Like, they are often trying to fulfill impossible standards. And my experience is that people who, I guess, have really, really high expectations on themselves are often very self-critical as well. And when they come in to get treatment for ADHD, there's a reason why they don't do so well sometimes, because once they're on stimulants, they want to catch up on the last 20 years of their lives, right?
And
so they just run themselves out, and then they really burn out after 3 months, and then they come back and they go, my meds are not working anymore. Can we up them? And that's kind of a problem, because if you think about it, if people are coming in because they want to improve their work functioning, their life, their interpersonal relationship, everything, do you really think a pill's going to do that? Right?
Yeah.
It actually is trying to shoot for the moon, which you won't get there, right? To answer that, you really need to ask someone what they're looking for and how do they think they'll get it, and what are kind of some patterns of behavior that they have in place that are maybe not so helpful. Maybe they're just really stuck in some old patterns of behavior that are maybe no longer relevant anymore. Maybe they're just, trying to survive or trying to, kind of protect themselves in a way that is still kind of fending off some old threats, which are no longer around.
So what's an example of some old behaviours is that to sort of cover up or compensate for the fact that you've got ADHD and you've been doing something that kind of compensates for that?
Like I said, it's very, very multifactorial. But what I'm, I guess, alluding to is complex trauma and the way people, protect themselves with behaviors and patterns of relationships that are often kind of, quite detrimental to their health long term, right? So people say, for example, if they have an ADHD that was never diagnosed, they may start to really use this self-critical response to threaten themselves so hard so that they have enough threat in order to do the work. So they are in this really highly stressed, high anxiety way of functioning all the time in order to fulfill this expectation.
You're saying they keep themselves under pressure.
They keep themselves under a lot of pressure all the time, and they never really know what it's like to be relaxed and calm.
Wow.
They're just highly strung all the time. When you get to your 40s and you're managing so many balls in the air, something's starting to crack. And if you are on stimulants and just making yourself do more, guess what? Something will still crack, right?
Wow.
Because we are humanly, not possible to hold that many balls in the air.
Because elevated stress levels must be bad for you in and of themselves, right? Yeah.
So I think what I really try to do is to, kind of try to sit with people and just walk with them as they kind of find out what sort of things have really tripped them up over the years and what are their kind of self-talk and what are the narratives. And then slowly kind of maybe just adding in some self-compassion, adding in some, self-acceptance there.
Yeah.
So I guess also if you're like that, that must affect your parenting and how you respond to your kids and bring them up. And are they also in this constant state of like high level kind
they
of,
might be if they genetically also have ADHD.
Yeah. But even if they don't, is it possible that they don't have it, but they're living in an environment where their parent is like constantly up there, but they're going, do we need to be like this or?
Yeah, so what's interesting is that description of really high self-critical, high stress, high expectations sort of manifestation is really resonating with some of our, like some of you here, right? Yeah. And so I think a lot of times it's just really listening to people's stories and seeing what really make them have to kind of respond in a really intense way, like what you're talking about in the parenting, right? Just remembering though, like, emotional regulation or the difficulty with that is also part of ADHD. So, what's the chicken, what's the egg? I guess that's kind of what we're talking about here.
Yeah. Actually, it's really interesting because, like, I was checking out this stats before, and it says the stats say that ADHD only affects about 5% of all Australian children and about 2.5% of adults. Yet, ADHD Australia says a whopping 75% of people with ADHD are undiagnosed. So how is that possible? So many people are kind of slipping through the cracks.
Yeah.
Well, because they've been like these young people that you were describing earlier who aren't, like, I don't know, Janet maybe didn't meet any young boys with ADHD, but Pansy is probably like me. During medicine, you just do at some point meet some little boys, like primary school boys who do have it. I can remember doing an interview and seriously, what I remember of the interview is that the young boy that I was seeing was hanging from the ceiling. Like he wasn't hanging from a chandelier, he was climbing up the walls, like onto the cupboard, up the wall, like quite literally.
Wow.
And I was doing a psychiatry term at the time, so I think he was a relatively bad case. But I kind of went, oh, like, really? That's ADHD. That's a thing. But the thing is that people tend to go, oh, yes, that's ADHD, and they're not looking at the boys and in particular the girls who don't present like that at all.
Yeah.
They're kind of quiet. And can you tell us a bit more about the ones who are just slipping through the diagnosis because they're not hanging from the ceiling like the one I saw?
They haven't got the HD, they've got the AD.
Yeah, so I think the statistic you were talking about, like I think if you even use the most conservative WHO prevalence, it's still 2% of adults. That's 1 in 50 people. And I think we're hardly providing enough services to actually let people get diagnosed and treated. And as you say, a lot of people are presenting now, and I think it's because, people are more educated about it. But I think there is actually a lot of backlog, and I think, they're probably not too far off.
So when you have ADHD and you're being treated for it and you've gone to see you and everything's fabulous now, is it actually sort of cured, or are you just managing it?
Look, like I said, your brain is neuroplastic. And so, once you're taking your meds and, actually using, some of your skills and choosing different ways of acting, I think you do actually build up new ways of managing life that often, more functional and, kind of long term, you will build up a lot better. And I think also people do end up finding the space where they work best. Like, for example, someone might have presented because they were working in a job where they have to manage a lot of projects on their own. But once they find out they have ADHD, they may kind of, choose a role where it's more kind of whatever comes, they just manage it as they go through the day. And it's a lot more like, go sort of thing that keeps them interested. So they might find a place where they actually work best with, their strengths. And then it might mean that they are actually functioning better as a result.
And so you could potentially go off the medication at some point, or would you have to always be taking it?
I think people like staying on it because it really does give them a lot more clarity of mind and a lot better functioning. But there have been people who are trying, to reduce their dose or go off the medication at some stage. Some have been successful. So I think it's just a way of kind of journeying with everyone and see how they go.
Because one of the other things is, it's a scary kind of set of medications. Like you say all those medications to me, and I just think, oh my goodness, I'm so scared of anything that's in that kind of amphetamine kind of group of medicines, like so scary, and yet seems to have this calming effect and not so scary. Sounds scary, not so scary. But the other thing about them, I believe, is they're not, even though you talk about long acting, they don't really hang around for a long time in the body. Is that right?
Okay. Mm-hmm.
There is this myth out there that, these are all, scary medications and, people abuse them and, they get them because they get a high. I find that most of the time that's not the case. I mean, obviously, there are times, people, misuse them. But most people I come across actually really respect the medication they're given. And when you think about it, if there's this myth that, people are trying to get it because they give them, some sort of euphoric effect, but you find the ADHDers forget to take the meds all the time. So it's obviously not the case, right? So it really, when it works well, it actually shouldn't be giving you a euphoric effect, right? It actually would just, kind of make you feel normal. The meds, are a controlled substance because it's that way. But I don't actually find them highly dangerous or scary. I just don't think that they work very well in the right individual, and we always have to support them in titrating the dose. And yes, you're right, they don't actually hang around in the body. Like, once you're off, once you take it that day, and it's on for you. Once you're off it, you're off. So even the long acting just hang around for about 12 hours or so.
Yeah, because I've seen myself, not that I do anything like you, Pansy.
Takes her kids' medications.
No, I believe a lot of people do take their kids' and that's part of their diagnosis journey. They come in and say, well, I've been taking, Sinead's, Ritalin, and actually I feel fantastic when I'm on it. But anyway, but yes, a lot of people say I can really tell when it's worn off and suddenly life is really difficult again.
Yeah.
I can remember talking to some parents who were like, we give our kid just enough Ritalin to get them through school and then they come home from school and then like they're a nightmare,
Yeah.
But we feel that's the best way to sort of manage them and their behaviour. But
I think it is a toss-up, isn't it, Pansy, like what you're going to do with either yourself or with your children. Yeah.
There are different ways of managing this, and I think maybe my philosophy may be a little bit different. It's actually important not to take too much and have too high an expectation. So for any normal human being, if you are asking them to focus all the way in the morning, focus all the way in the afternoon, and then in the evening still go and, study for a few hours, most people can't. Really, right? What's normal? You probably wake up. It takes you a while to kind of, get going, and then you can focus for 2 hours, and then you need to kind of go and have lunch, faff around a bit, talk to people. You might be able to then push yourself to focus for another section, right, of the time. And after about 2-3 hours, I bet you're knackered. I bet you can't actually go and be really kind to your partner or, be all caring to your kids. I think most people would be actually quite easily short-tempered by that stage. So you really need to then go into some self-care mode, give yourself a break, maybe go for a walk, and then you can come back and go, okay, away we go. We can do, the family dinner or get ready for tomorrow, right?
What other sort of things, apart from the medication, seem to help people with ADHD? What classically are kind of helping behaviours?
Now, I like to really go back and just go, like, what helps all of us function well, right? So if you think about, ADHDers, like if you're on stimulants, but you're still gaming until 3 a.m. every night, or you're drinking, 2 bottles of wine a night, or you're working like 60 hours a week, you're not going to function well. Your mental health's not going to be great, right? So what are the basic things that we put in place? Are we trying to sleep, enough hours? Are we trying to sleep at the same time, wake up at the same time every day? Are we eating 3 meals a day? So, being on stimulants sometimes take away people's appetite, and people go, yes, I can now go and diet. Actually, it doesn't work that way because, firstly, you need the food to fuel your brain, and people can get quite angsty if they're not eating through the day as well. Hungry, yes. The stimulants actually don't work very well if you're not eating. Yeah, so I think, eating nourishing, healthy food, exercising regularly, all of those things actually really help, like, connecting with friends, having that kind of self-care. I guess the other things is, being really connected with yourself, need time and space. Right? How are you looking after your own mental health rather than just kind of being on the go and being reactive to everything else except, caring for yourself. And we're a whole person. So, we want to be caring for ourselves, mind, body, spirit, right? How are you actually giving yourself enough space to connect with your loved ones, connect with your community, connect to God if you have a faith. Those things are all really, really important for mental health. And so I think all of them also help in treatment of ADHD.
Yeah.
It's interesting. One of my girlfriends, like her son has sort of been diagnosed with it, but she was talking about some of the really positive things about his behaviour actually, because he's really, really like caring, very empathetic and also very creative. So I'm wondering if they are part and parcel of having it or whether that's just sort of coincidental.
Yes, I think there is, a certain kind of picture of the ADHD being actually very creative and, kind of spontaneous and have kind of, ideas that are kind of more out of the box, I guess. So I think that's probably true because I think, part of the brain pathways, like the developmental network is meant to be linked to creativity, and that's like a more hyperactive sort of place of the brain. But I think the answer to that is when you're on treatment, it shouldn't actually change essentially who you are. It's not about changing your personality. No. So you still be who you are. It's just that you have a choice to kind of choose less of some behaviors that are unhelpful and choose to, prioritize the things that are helpful and, good for life and relationships, right?
Yeah. Well, I mean, there's been some pretty high achievers who have ADHD. I read recently that Simone Biles, very topical
That's
at the moment, has
I
ADHD.
came in today and Janet said Simone Biles has it. And I went, well, there we go.
Yeah, and she's pretty high achieving. But also Ryan Gosling, Richard Branson, Jamie Oliver, Michael Jordan, Emma Watson, Harry Potter,
Yeah.
So I think that's really interesting because, like, these are highly successful people, and of course people look up to people like that, and it's cool to know, like, especially someone like Simone Biles, who's incredibly successful and topical, that she has come out and said, hey, I've got it, I'm being treated for it, there's nothing wrong with that. And,
Yes.
you can be who you are.
Yeah, it just proves that, ADHDers can be successful, which we already know, so that's great.
Yeah, that's right. Just like anything, right?
That's right.
And so if people are listening to this and thinking, ooh, you know what, me or my loved one, I feel like maybe we might have ADHD, what should they do? How should they go about finding out? Are you going to get a million phone calls in the next week, do you think?
Yes, she is.
So I think, there are definitely more ways to, get help. You can call us up or, call up a psychiatrist or, maybe like, GPs with a interest in psychological medicine, like members of ASPM or other mental health professionals who have ADHD expertise. They can all help. And there are definitely also a lot of resources on the internet that actually, gives you a lot of information now about ADHD. So they're all great resources to look up. And I think, if you yourself or a loved one has some, kind of some of these symptoms, just going back to what we were talking about before, are you doing the basic things? Are you sleeping?
Yes.
Are you eating? Are you exercising? Are you connecting with people? Are you, looking after your own health and giving yourself permission to maybe look into how to get some help and,
Exactly. A magic pill is not
A magic bullet.
everything. It's not everything. You need those really basic, helpful things as well. Hey, one of the things, of course, is that it takes a long time these days in this post-COVID world. It takes bazillions of years to actually book in to see a psychiatrist. So, yes, any comments about that?
Yeah, unfortunately, there are a really long waiting list for a lot of psychiatrists, and that's why we're here. That's why we started a mental health GP program. That's why me and my colleagues are doing this assessment and treatment along with the psychiatrist support. But yes, I do recognise that there is a really big backlog right now. But I think it is good that people are recognising, ADHD more and also, starting to get help for it.
Actually, tell us what the waiting time is for your clinic. Like how long, if you ring up and make an appointment, about how long is it?
It should only be a couple of months, but because we are treating ADHDers, sometimes they forget their appointments and then we have cancellations. So you might be able to get in just on the same day even. So often, always try. I say always just try.
If you pick the right syndrome, you can get in to see a specialist
But I was
earlier.
going to say, can I just say 3 months or 4 months is a lot better than the kind of 9 months to a year that you often
it
hear
really
people
is.
talk about.
Wow.
Yeah.
Wow.
Yeah. Pansy, this has been great. Very informative.
Absolutely fantastic.
Yeah.
And
That's
I
great.
will
I'm glad.
see you in about November, on the 12th of November. Are you free then?
Oh,
I
right.
was just going to book in for an appointment.
Right. I was going to say, so am I. I was going to say, we're both going to book in and see Pansy.
We'll do a double appointment.
Excellent. What a great
Look
idea.
forward to it.
Thank you ever so much for coming in and chatting to us about this. And I feel sure that our listeners are going to feel. And the other thing about this, it's been really good and very
Just
it's taken
normalising
down
it.
normalising it takes the
Stigma out of it.
scariness out of it.
Yeah. Yeah, thanks, Dr.
Really
Pansy.
helpful.
That's great. I'm so glad.
Gorgi, we hope you enjoyed this episode, but we'd love to get to know you better and share more about our lives, what we get up to, what you get up to, and some insider goss and cheeky sneak peeks.
So why not join our Facebook group? It's called She Wasn't Born Yesterday, for lots of little extras. Your chance to comment, make suggestions, tell us if there's a topic you'd like us to talk about.
Or just to say g'day. Either way, join us next week on She Wasn't Born Yesterday. We look forward to your company.
1032. Thanks for listening.